Definitely prompt diagnosis is important. First of all, tell what the child has. It starts from a very good history. So you take your history, appreciate the social circumstance. Is this child HIV exposed? Are they maybe having any other chronic illnesses? All this information is very important for you to be able to delineate the possible causes. So quickly we shall see a child, mother comes in, tells you, child has been coughing for 3 days, goes to kindergarten school. We all know what happens in kindergarten. We are singing, we are sneezing, we are laughing, everything is going on. And that's how the virus is run from one person to another. If it's taken longer than 2 weeks, then you want to think this is a chronic problem. Could there be a person who has TB at home or in the community where the child hails? So once you're done with that, then you categorize. Is this child having a fever? Yes. Are they having trouble breathing? Yes or no. Then you know that this is just a common cold, okay? And we can simply manage with a few remedies, manage the symptoms, manage the fever, help with that cough, and we should be fine, okay? If they're having fast breathing, okay, they're having trouble breathing, they're having a fever, but they're not very sick, okay, then you know they've gotten into category 2 of a pneumonia, okay? So we always have some supportive labs that can tell you this is a viral cough, pneumonia, so manage symptoms, educate the parent on what to look out for, that this is becoming severe, child is not feeding, child is restless, they are not having trouble breathing, they are turning blue centrally around the lips. That means they are not getting enough oxygen and they need hospitalization, okay? So when we talk about the allergic tendencies, remember we talked about periodicity. Those children who just have a cough in the evening, in the night, when it turns cold, okay? So one thing that is very important as we discuss, could this be asthma, could this not be asthma? There's a child who comes to you less than 2 years and they are wheezing for the first time, they are having a cough, a mild fever, but they are happy, they are playing, but they are wheezing, hee, and they are happy. What we call happy wheezers, eh? So happy wheezers is what makes the diagnosis for you that this is bronchiolitis. Bronchiolitis is common in those children less than 2 years. So whereas an asthmatic will come with recurrent episodes of wheezing improved by nebulization with a bronchodilator, those are the salbutamols that you hear about. There are other causes of wheezing. A child comes all of a sudden, has been happy and playing, and then they had a few beans around them, then they have trouble breathing, you listen to their chest with your stethoscope, and they are wheezing on one side. Be sure that that child has eaten one of those, has inhaled one of those beans or nuts that is there. So you need to be very, very careful in delineating the possible cause of the wheeze, the possible cause of the difficulty in breathing, and you need to exhaustively remove and be sure that there are no other systems that might be in play here. For example, the heart. A troubled heart can cause pneumonia-like symptoms, okay? So you need to have a very good clinical acumen.